Depression's treatable, patients need to know that. Psychotherapy, antidepressant medications, there's other things that can be done to help people, but people need to know, number one, it's not that uncommon in a chronic disease, and number two, there are things that can be done. Depressed people lose insight, and when they lose insight, they may lose hope, and if they lose insight and hope, they may not even think there's something that can fix their condition, they may just feel like that's it. Okay, any questions about depression and chronic disease? Nope. Makes sense? Okay. Anxiety, excessive worry. We all have anxiety in professional programs. That's pretty normal. Whether it is about a specific thing or not, it can be a sign of an anxiety disorder when it becomes excessive. It's the excessive worry that's the issue. Providers need to encourage patients to be open about their feelings if they're experiencing excessive worrying. That's why it's always good to ask people, how are you doing? What are your concerns? How is life treating you these days? And you need that relationship with that patient sufficient enough that they will tell you these things. So relationship development is big in being a healthcare provider because it's really your road into the most important things to get people more healthy. Symptoms of anxiety are a lot of things: irritability, restlessness, poor memory, trouble concentrating or making decisions, weakness, dizziness, sweating, and shaking. Have y'all done hypoglycemia yet, Dr. Latesse?
No, sir.
Okay, just a note, as you study all this stuff for your first test, note those symptoms, weakness, dizziness, sweating, and shaking, could be symptoms of hypoglycemia, low blood sugar. So when you're hearing things from patients, you kind of have to think in a lot of different venues at once. That's why finger stick blood sugar checks are so helpful. If you've got symptoms of low blood sugar, then bingo, you're getting closer to figuring stuff out. If you have symptoms and your blood sugar's okay or high, then maybe you have anxiety, on top of it. Okay. Depression. This is interesting. Biological factors associated with depression and chronic disease, and also anxiety. I meant to label this depression and anxiety. Increased levels of pro-inflammatory cytokines have been seen, and you know what that means in the pathophysiology of vascular disease. Hypothalamic pituitary axis may be activated under stress, resulting in higher cortisol levels. Have y'all talked about the HPA axis in diabetes? So y'all know that cortisol can increase blood sugar. So if you're under stress, cortisol goes up, sugar goes up. If you have diabetes and you're stressed, they're making each other worse, okay? The sympathetic nervous system may be activated under stress, resulting in increased catecholamine levels, which can also make blood sugar go up, okay? The fight or flight syndrome for a reason, it just quick sugar burst. So, just to digress just a tad bit, when you're looking at diabetes and somebody says they're stressed, and this is why it's important to figure out, are you stressed or are you not? If somebody's under inordinate stress and their blood sugars are up, that may all by itself be enough reason to explain it. And I know that I used to see this, you kind of think, oh, it can't be that big of a deal. You're thinking like maybe 40 or 50 points or something like that if you're stressed. It can be 200, 300. I mean, you will be shocked out of your mind. They'll be rocking along 120, 130, 140 on treatment. Come in one day, 250, 300, 350. And you're thinking, well, you quit taking your medicine. You're eating bad. And no, somebody died. Somebody shot through the window of their house, and they're worried they're going to get killed. And so it's just anxiety, and their numbers are through the roof. So it's quite dramatic. Okay. Okay, anxiety may be treated with both medications and non-drug techniques, and we'll worry about all those things in the psych module, but if there are ways to deal with it. It's better to deal with anxiety by understanding it and not using medication. That's the trick, is not getting people hooked on medications anytime they get kind of strung out over something. Okay, patients, feelings, attitudes, and perception about chronic disease. I think I'm going to let y'all do a break because we're kind of on y'all's regular hour thing. Why don't we just do like 10 and just come back and just kind of stay fresh?